Hi, my name's Ian Wright, and before I start this podcast, I just want to say that these are personal views, and as with anything, we need to just research to find out the best way, because some of these issues are quite complicated, and especially I'm talking about methods and methodologies in treating food allergies and intolerances in children. But I'll come to that, because what I want to talk about, first of all, is this idea of overfeeding babies and actually bringing solids on too early, which I mentioned a little bit last time. But overfeeding babies is something I see a lot in practice. I spend a lot of time actually working with babies, young babies, and growing actually older children who have unresolved gastroesophageal reflux patterns. Now, a baby who has reflux means there's a weakness in the gastroesophageal valve, meaning that some of the acids from the stomach and some of the undigested milk can come back up into the esophagus, which is not designed to take the acidity. And it can inflame the esophageal wall and irritate it and cause a great deal of pain and discomfort. And this is especially true in the kind of cases of silent reflux, where the baby is not bringing up a lot. If you're actually throwing everything back up, if there's like a very active reflux, they tend to bring their entire contents of the stomach up, which actually lines the stomach wall and causes, and the esophageal wall again, which causes less of pain. So some of these cases of silent reflux, where there's actually very little posited, maybe a little bit of colourless stomach acid fluid that can come up, and not necessarily all the white stuff, they can be very, very painful. And these children are the children who are moving around the whole time. They actually cannot stay still. They're irritable. They don't stop moving. It's like they're dealing with a low level of pain the entire time, and they literally don't stay still until they sleep. And obviously sleeping is difficult. Other symptoms is they find it difficult to feed. They only take a couple of ounces and then they start squirming, and they're immediately irritable after a feed. And that can go on until the next feed. What they tend to want to do, even though they find feeding difficult, is they're wanting to constantly crave the breast or the bottle feeding. So what tends to happen, even though they don't take much, is they tend to overfeed because they're feeding the entire time. Because when you drink milk, it calms down the acid on the stomach wall. Now, this is a problem, and it can become an increasing problem as they get older as well, because these children tend to overfeed. When they overfeed, of course, the stomach gets full. There's more pressure in the stomach and the small intestine, and that puts pressure on an already weakened valve, the gastroesophageal valve, so the reflux continues and gets worse. So it doesn't help. Also, it gives them other digestive colicky issues, because the small intestine is overwhelmed with too much food in terms of milk and has difficulty digesting. So there's bowel issues, and they get more gripey tummy pains, wind. So the whole thing gets into this cycle. So very importantly, try not to overfeed, and feed little and often. And obviously the ideal thing is to resolve the reflux, be it medication, be it treatment with us or whatever. This tends to set up a pattern of overfeeding. If you overfeed too young a child, they tend to want too much food, and they continue in this process of overfeeding. So this brings me on to solids. So you get a child who's, say, 4 months old, and maybe they've had a little bit of reflux or not, and they're constantly hungry. So what you do is you introduce solids too young, and there's often the advice is to give these solids very young these days. And I think that personally is a problem, because a lot of the issues, the gastrointestinal issues that we see in practice, are related to an immature gut. The gut immune system is not mature enough, and the gut biome, the bacterial basis that's in the intestinal system, aren't able and proficient enough at this young stage to digest some of these complex proteins, especially proteins, in the system. And so that causes digestive difficulties and a lack of digestion. And that's a problem, and that can create problems later. What we're doing is we're starting to create an issue that can come back and haunt us for life, because we're setting up the kind of habits of the gut very early on. And that is very important to be said with regards to sugars. They're giving young children, there's lots of natural sugars in breast milk, in cow's milk, and all the other milks that children have now, but these are natural, easily digested sugars. But processed sugars, highly processed sugars, stimulate a response in the stomach, which makes you, when you've eaten something sweet, you want to eat again within 20 minutes. It's very quick. It has that quick fire reaction where the body needs something else very soon, because the sugar's broken down too quick, floods the system. Insulin levels up and down very quickly, and you need this next fix of sugar. Now, you set that pattern up very early in a child by giving them too much sugar, then they tend to overeat bad things and become obese. And obesity, of course, is a huge thing in children nowadays, and it's something that we need to work with. Also, if you think about it, you can set up these bad habits by overfeeding a child, by all good reasons. People who, the mothers who are overfeeding these children sometimes, it's a very real and very needed thing. The problem, of course, is how on earth do we know whether we're over or underfeeding? I think the best thing is to go by the usual guidelines of what a child needs. Very, very few babies who even have very severe digestive difficulties are actually underfed. They still have enough fat around the tummy. They put on weight. Even those who lose weight a little bit at the beginning, and they're slow to put it back on, they're thriving, and thriving is very important. And I think the margins are wider than are currently kind of considered in terms of nutrition. And I think most babies are getting enough nutrition, even if it's slow. And weight is slow to come on. This, again, it's fine lines, and you have to consider the baby's overall health. So try not to introduce solids too young. Allow for foods which are easily digested at the beginning, so that the gut immune system and the gut digestive system can mature at its own rate and is not overloaded. So I just want to talk a little bit about food allergies and food intolerances. Now, for example, let's talk about a lactose or milk protein, various milk protein allergies. If your child has a very strong milk protein allergy, they'll have a huge reaction to it. They can get incredibly sick, severe skin rashes, diarrhea, severe constipation. It shuts everything down. These come up very clearly on blood tests. You blood test this child, and it is very clearly they're allergic. Their IgE goes up. It's a very specific, strong reaction to milk protein, say. A lot of babies and children have more of an intolerance. It irritates their system, but they can cope with it. And these babies can tend to get the classic reactions to milk and its proteins in terms of the immune system are skin reactions, eczema, chestiness, mucus, and excess of mucus, and constipation. A classic reaction to a mild intolerance in milk proteins is constipation. And, you see a lot of children coming in with this kind of combination, skin, constipation, and, we always have to look at and evaluate whether this child actually has some sort of intolerance, even if it wouldn't be blood tested. It's important to find out, really, I suppose, what areas are a problem for children. And there's a very big fashion within the medical immunology right now to do something called immunotherapy for food sensitivities and allergies, which is quite interesting area. And it's very new. And I've just been kind of looking into that a little bit because I've been struck by seeing some children in this last week who are given this provocation test to desensitize. So the child has, say, a milk allergy, and they want to keep provoking the child, giving the child a little bit more and a little bit more milk in order to desensitize the immune system to the milk. For me, looking at the evidence and the research, it's not, the evidence isn't quite there yet. There are some very good studies, I think, that I've looked at where, in a high level of cases, you can get a decrease in symptomology and IgE reactions if you keep doing the steady provocation, either it's onto the tongue or under the skin. But there is still a tendency, and you still cannot rule out strong anaphylactic shocks from certain foods if you stimulate the child. The child that I saw this week has had a very strong reaction to dairy in terms of the skin was quite severe in terms of rash. The child was hyper irritable every time it encountered milk, and we tested milk very clearly as a problem. But the immune team and the dermatology team was saying, no, we have to keep provoking, keep desensitizing. And it just made me think, I don't understand why it's so important to do so. Why do we need cow's milk? Why is it so important to us? Because, for example, we can get calcium and all the other nutrients from other types of milk very readily now. The almond milks and your green leafy vegetables. We don't have to actually have dairy produce. I don't know why there's such a big thing for us, forcing us to have and to desensitize to dairy produce. My son didn't take dairy until he was old enough to put cheese on his pizza, and he doesn't mind it now. He had none of it, from his whole upbringing, and he's strapping, and there's nothing wrong with him. And he just doesn't like dairy. And whenever his mother had milk, when she fed him in the breast, it was like sour or something. As soon as she'd had some milk, he would spit out her breast milk because the lactose gets passed straight through. So she had to withdraw it from the milk, and then he didn't mind. It was okay. So I don't know. The jury's out. I can see that there is positive evidence around it, but I'm not entirely sure in some cases where you're constantly provoking an allergic reaction in a child where they're constantly irritable and not very well because of it on something that's, that they don't necessarily need to have in their diet. Now, if you think about peanut allergies, anything that will treat the tendency towards a severe anaphylactic shock, and if you can desensitize that by doing something that will provoke it, and with this immunotherapy, that makes sense, because it's impossible to always withdraw yourself from nuts, and it's impossible to withdraw yourself always from dairy. But the question is do you need to, if it's an allergy, but it's not a severe life-threatening allergy? I don't understand it. It's something that I need to consider more and think about, because I'm treating these children who have very strong reactions, and then they're not so well, because they're being provoked all the time. So, it's something for me anyway to consider at the moment. So there's this big difference between allergy and intolerance, and there can be things that we're intolerant to that just they cause our body distress. So, for example, personally for me, I have very little dairy produce, but I have a little. I have very little wheat or gluten, because I know it's hard. It makes me bloat. I get tired. I don't have any allergy to them. If you blood tested me, I would be fine. But I know for a fact that I feel better if I don't have them. And that's okay. It doesn't mean I should have them. I don't need to stimulate myself with them to allow myself to cope with them more. That to me doesn't make sense, So interesting, how these therapies and these immunotherapies are changing. My way of looking at it would be to desensitize and strengthen the immune system so they can cope with these things. That's much better, withdrawing them for a while, allowing the body to rebalance itself, not necessarily keep prodding them. I get the theory of it, and I can see that there is evidence. Anyways, that's an ongoing one. I'm going to continue talking about specific issues and how some sort of nutritional therapy can be helpful, for example, ASD and other specific learning difficulties and inflammation. The next one I'll do is on inflammation. I wish you well.